Hi, welcome. Thanks for joining us today. We are here at Cooper Trauma. We are talking with Dr. John Porter, who is the division head for trauma services here at Cooper University Healthcare. Dr. Porter, why don't you tell us a little bit about yourself?
Okay, thank you for having me. Welcome, Facebook. However, before I talk about myself, I'd be remiss if I didn't give a shout out to all of the Cooper nurses, since this is Nurses Week, and especially to the Trauma Surgical Intensive Care Unit and to 7 North and to the Step Down, because one of the things that makes Cooper special in trauma is our nurses. So shout out to the nurses, and I wanted to get that done first because that's important. About me, I've been here for 3 years. I've been doing trauma for a very long time. I think I decided that I wanted to be a trauma surgeon when I saw President Kennedy get shot, and I had the belief that I wanted a job where I could save the president if he was shot. I was 4 at the time. For all of you doing math, you now know how old I am. And I did my medical school and residency training at Johns Hopkins and did a trauma fellowship at Penn, and have worked around the country as a trauma medical director, but have been here at Cooper since 2015 in March.
Great. Thanks for having us, Dr. Porter, and thank you again for giving the shout out to all the great nurses here at Cooper. We really appreciate that, all the work that they do.
Yes.
So, May is Trauma Awareness Month, which
Yes.
is why we are having this conversation. And one of the things that I wanted to touch on, to talk a little bit about, is I think there's some myths that might be out there, or a little bit of confusion of maybe what makes a trauma center versus going to a regular ED, a regular hospital.
Yes.
So maybe you can talk to us a little bit about the difference between coming to a trauma center like Cooper or maybe going to a community hospital.
Yes, well, the first thing I want to make clear is that all the hospitals in the country and all the hospitals in southern New Jersey have emergency department. They have trained nurses, they have trained emergency medicine physicians that can handle a variety of emergencies: heart attacks, strokes, sprained ankles, broken feet, all those sorts of things that happen. However, we specialize in trauma. And so what makes a trauma center special is that no matter what has happened to you, we have people there ready to take care of it. Other hospitals may have a neurosurgeon that's home, may not even have a neurosurgeon. They don't have an orthopedic trauma specialist that can handle that. They don't have a special plastic surgeon that can fix complex wounds. They don't have nurses that see trauma all the time. We have that all the time. The phrase of 24/7 is used a lot, but we have it every day of the year, every hour of the day. And if you need a heart surgeon because something happened to the heart, we have that. If you need an orthopedic surgeon because you have a fracture in your pelvis, we have that. If you've fallen off your ladder because you decided you wanted to clean your gutters out and no one was holding the ladder, and because you didn't want to do the safety things that are necessary, then we can take care of your head injury, your rib fractures, and take your spleen out. All those things that we would need to do no matter what happens. And so that's what makes us different. And so there are so many people here that take care of you when there's an overhead page that says trauma coming to trauma admitting. There's security that controls the area so that the area is safe. If you were unfortunate enough to have been shot, what if the people who shot you are trying to come finish? We have security protecting the area. We have a chaplain that comes to provide support for the family, because the trauma doesn't just affect the patient, it affects the family. So now while the doctors and nurses are working hard on the patient, we have the chaplain there to provide support for the family. We have the blood bank to get ready so that there's blood available for you. The OR gets ready. There's a room held empty 24 hours a day so that we can get you to the OR immediately. And when I say immediately, sometimes it's within 2 or 3 minutes of you showing up, you can be in the operating room. At some of the other hospitals that we talked about, they may have an operating room, but the anesthesiologist is home and has an hour to come in when he gets called. The OR nurse is home and may have an hour to come in before they're called. We have you in the OR in 2 minutes. So you can see the difference of what's available. And that was just basically the tip of the iceberg of what's available. There's not a thing that we cannot handle at a level 1 trauma center when a patient comes in. So I'm not saying anything bad about any of the other hospitals. I'm just saying all the good stuff about us.
Great, that is very helpful. When should you go to a trauma center?
Well, trauma is actually interesting, and it's a very good question. Cooper is a fantastic hospital in other things besides trauma, and there are a lot of good hospitals in New Jersey that do a lot of good things, and some across the river, but we won't mention anything across the river today. We'll let them take care of themselves. We're good on this side of the river. But if you have cancer, if you need your gallbladder out, if you have diabetes, you have time to pick your doctor. You could actually go on Google and do a search and pick your doctor and look at their scores and look where they trained and look at how the nurses are. Trauma is different. You may have crashed your car on the highway. EMS comes and picks you up and takes you to the trauma center. You didn't have a choice. And so that's the important thing about being the trauma, is that you don't have a choice. And so that's why we have to be good to provide the care to everybody. And whether you're the president or whether you're homeless, we're ready to take care of you. When President Obama came to Camden, we had his medical records. We knew his blood type. We had his blood in the trauma admitting. We had Secret Service stationed in trauma admitting, and we were ready to take care of him. But the thing is we are that ready to take care of you if something happens to you.
Great. Thank you for sharing that. You mentioned a little bit about a level 1 trauma center. Now, I know there's a couple different levels to trauma. So I know it goes, level 1's the highest and it goes down to a level 4. Can you explain the difference between those levels?
Right. So in New Jersey, we have a very nice system. The American College of Surgeons comes in and verifies the trauma center. There are about 380 things that they look at to be a level 1 trauma center. And when they looked at us most recently in March of 2017, I'm proud to say that of those 380 things that they looked at, they found 0 deficiencies. I'm going to pause for a second so you can let that sink in. 380 things that they looked at, and they found 0 deficiencies. And then once the American College of Surgeons verifies you as a trauma center, then the state then designates you as a trauma center, so that now EMS has the permission to bring patients to you. So until you've been verified and then subsequently designated by the state, EMS is not supposed to bring the sickest patients to that hospital as a trauma center. Then we have level 2 trauma centers in New Jersey, and they have fewer things in which they need to meet. They may not have a cardiac surgeon, they may not have bypass, they may not have some of those other things, but they're still ready to provide excellent care. We don't have level 3 centers or level 4 centers in New Jersey. And if you talk to the American College of Surgeons, those places just have a general surgeon, may only have an orthopedic surgeon. And when you get down to level 4, you basically have a fancy ED with transfer agreements with other centers. Because of how the trauma centers are spaced in New Jersey, in the population centers in New Jersey, most people are close enough to a level 2 or a level 1 so that we don't need level 3 and level 4 here in New Jersey.
Okay, great. That's really informative, helpful information. What do you think sets the Cooper trauma system apart?
Well, there's a lot of stuff in the world today talking about systems, and that if you have a good system, things work. And when errors happen, it's because the system doesn't work. And we have a good system. But what really makes Cooper special is that we have good people. And some of the people are not only just good, they're great. And so we have great surgeons, we have great nurses, we have great emergency medicine. The orthopedic trauma surgeons are fantastic. The neurosurgeons are top line. I've already mentioned the nurses at the very beginning. So all of the people are what makes Cooper special. Now we have good systems, but I am of the belief that good people trumps a good system, and we have both, so that's what makes us special.
Great. So as you know, we talked about it, May is Trauma Awareness Month.
Yes.
What are some of the things that Cooper's doing out in the community to really help prevent traumas? Because we know a lot of traumas, you mentioned falling
Right.
off the ladder, those can all really be can be prevented.
Right. So the interesting thing is the importance of language. So several years ago, we changed from MVA, which was a motor vehicle accident, to MVC, which is motor vehicle crash, because an accident technically can't be prevented, whereas a crash has things that you can fix to prevent it. So we have an outreach and prevention program that the American College of Surgeons raved about. The book of things that we do is literally that thick. And so we do things on prevention with falls. So much so that sometimes if a person falls a lot, we send people out to the house to inspect the house, to sort of, you got your bathroom right next to the stairs, so the person gets up in the middle of the night, is a little disoriented, thinks they're going into the bathroom, and they fall down the stairs. And so we say change those sorts of things. Or they have a loose rug right at the top of the stairs, so they hit that and then they're gone. And so we do fall prevention, because 42% of the patients that we see are falls. So a lot of people think of the gunshot wounds, and I know I'm going to digress a little bit, but a lot of people think of the gunshot wounds and the stabbings, and they sort of say, well, I'm never going to get shot and I'm never going to get stabbed. And I hope that is the case. But again, 42% of our patients fall, and we are all susceptible to gravity. So any day you could be a fall victim. The next highest number of patients are the people who are driving cars. All of us drive cars. We're not taking horses to work. We're not walking to work. I sometimes walk to work when the weather's nice, but we're taking cars. So everybody is at risk to be a trauma patient. So that's where our prevention stuff goes to. So then we have things about texting and driving, distracted driving. Obviously all the things with don't drive drunk. And then when summer comes and people go to the shore, we have those things about don't drive your boat and drink as well. Because if you can't control your car while you've had several drinks, you can't control your boat either. And then we have things where we go out for prom prevention, so that we have them when we show a car that's crashed up, and we bring the helicopter in and talk about prom safety and all those other sorts of things. And then we have the TIPS program, where we bring young folks in and show them what happens to a trauma patient, so that they now know what the consequences are if they're not wearing their seat belts, or if they're doing distracted driving, so they can see, and they come in, they see the helipad, they see sick patients, they see the size of the tubes and things that we put in people, and that scares them. And then hopefully now they're going to wear their seat belt and they won't text and drive. We get people to sign agreements that they're not going to text and drive and all of that. And then why I got people looking, don't text and drive, pull over to the side of the road if the text is that important.
It was one of the questions I was going to ask you. I know there's been some studies out by the National Transportation Safety Board that for the first time in I think 10 years, the rise of motor vehicle crashes has actually gone up.
Yes.
Where it's been going down, and I think that can be...
Right, and the interesting thing is what they have done, they put a camera in the car and actually look at the driver's eyes. And if you're driving the car and you're not on the phone, whether it's in your hand or Bluetooth, your eyes are constantly moving around, looking in the rear view mirror, peeking in the side mirrors. Your eyes are doing that. When you talk on the phone, whether it's hands-free or you're holding the phone, the number of eye motions goes down. So you're distracted, even when you're using Bluetooth in the car. But talking and texting, now looking and doing this, or doing this if you got the iPhone, and they said that that's equivalent to having several drinks. And so texting and driving is a big thing. And the physicians and nurses and other folks are getting important texts. You got to pull over to the side of the road and answer the text if it's that important. But just to hit a smiley face back, it's not worth it. Because to think about it, if you're going 55 miles an hour, you're going about 88 feet per second. And most cars take between 150 feet to 200 feet to stop. So that means when you look down for 1 second, you've gone 88 feet. And now if you hit the brakes, it's going to take you another 150 to 200 feet to stop. So basically that's the length of a football field that you've lost in stopping distance from a 1 second text. And who does a 1 second text? You're doing that. That's 3 or 4 seconds. Someone pops up in front of you. You can't stop. You can't stop. And so you can't text and drive.
Yeah, all really good points. And I know definitely some of the stuff the American College of Surgeons, the 50-year anniversary of Trauma Awareness Month, they really are honing in on the ways that we can prevent trauma. Distracted driving is one of them, and doing a lot of education around that, and a lot of education around falls.
Yes, definitely falls. You know, and ladder safety, always have someone holding the ladder. Don't go up to the total top rung. And then, you know, if you're not supposed to drink and drive, and you're not supposed to drink and get in your boat, you probably shouldn't drink and then try to clean the leaves out of your gutters.
That's good advice. One of the other big initiatives that the American College of Surgeons in regards to trauma awareness has going on, and Cooper is very proud to be a part of it, is the Stop the Bleed the campaign.
Yes.
And I know that there's been a big push for Cooper Trauma to really get out into the community and do this type of training. Can you talk a little bit about Stop the Bleed?
The Stop the Bleed thing came from sometimes when you're in a traumatic injury, the injuries are so bad that no matter what happens, you're not going to make it. But on the other hand, there are times when if you had received the proper care timely, the death could have been prevented. And most of those deaths that could be prevented are from bleeding to death. And so Stop the Bleed is what we can do in the public to actually control bleeding at the site. So in mass shootings, what is happening to most of those people that are dying that is prevented, they're bleeding to death from, because the artery in the thigh is bleeding. And if you just held pressure on it, you could stop it. Or if you used a tourniquet applied appropriately, you could stop that bleeding. Or something happened in the arm and the big blood vessel in the arm is bleeding, and if you put the tourniquet on the arm, you can stop that from happening. So what we have done, it's a national program, but what we have done, we have provided tourniquets to all of the police, so that if they get to shootings a lot sooner, because they're the police. And they get there, and in Camden now, they can actually apply the tourniquet on the person, whether the shooting was done by the police or done by someone else. And so that's important. But the other thing is, we've given it to school teachers. We're teaching the public. We hand out the tourniquets. So I have a tourniquet in my car, so that if I come up on a scene, I can go into my trunk, pull my tourniquet out, and maybe stop the bleeding. And so if I stop the bleeding, then they have time to get to the hospital and have the other stuff done. And so the studies have shown that to be the case. But it's one thing to say that studies have shown it, and then it's another thing to put it into action. So we teach it to our staff. We go out and teach it to churches and to schools, and to certain folks like police and schools, we've actually provided tourniquets. So we haven't given tourniquets to every teacher in Camden County, but we've given it to every nurse that works at the school in Camden County. So if something happens, there's some things there, because the goal in trauma is to do enough prevention work so that we put ourselves out of business, because all of the things that we take care of are preventable.
Yeah.
And so by doing the prevention work and the outreach, we can put ourselves out of business. That's the goal.
One other point to talk about a little bit in regards to, so we have our level 1 adult trauma center here at Cooper, but we also have a level 2 pediatric trauma center.
Yes.
So can you talk a little bit about our pediatric trauma?
Yes, and so we're level 2, and so someone listening might, well, we said level 1 was the highest, why are we level 2? To be level 1 in pediatrics, you have to be an independent, freestanding children's hospital. Our great children's hospital that we have here is a children's hospital within a hospital, so we can't be level 1 because we're not a freestanding children's hospital. So we're at the next level. So we take care of all of pediatrics. So everything that I said about adult, that we have emergency medicine, we have great nurses, we have neurosurgeons, we have orthopedics, etc., all that apply to adults applies to kids, all the way up from newborns to the 16 years old, which is the cutoff that we use for kids.
And it seems to be it's a unique situation for Cooper to have a level 1 adult and level 2 pediatric together.
Yes.
So God forbid you were to be in some type of crash or
We can
some
keep
type
we
of
can
trauma,
keep the families together.
We can keep the families together, which
together.
I think is important.
There's only one other verified pediatric trauma center in the state other than us.
So we did get a question in, and it has to do with, in the event of a mass trauma, if a mass trauma was to happen, the capabilities of Cooper to handle that.
Well, see, that one's going to depend on mass. Mass is going to vary. If we talk about 3 patients in a car at the same time, we get that routinely. If we talk about 10 patients in a big van, that's something that we can handle easily. If we talk about a train crashing at the Walter Rand and 300 people getting hurt at the same time, no hospital can take care of 300. So it varies. But if one of the shootings that has happened, we have trained for that. We have protocols for that. We have things where we move people out of the critical care areas to make space. We have a call list where I can call in my surgeons, anesthesia can call in their people, nurses can call in their people, and then we have communication with the other hospitals in their area so that we make sure that we get the ones that are really, really sick, and that the ones that are just sort of the walking wounded per se go to the other places, so that we're not inundated with the people that just have a scratch but are still scared and traumatized from the event, so that we can take care of the ones that are really hurt. So there we've had practice with multiple things coming in all the time. We've practiced with drills, and we've communicated with the other hospitals so that things could work out. So rest assured that if something like that unfortunately happened in southern New Jersey, Cooper University Trauma Center would be ready.
Great, good to know. We have a couple more things. So going back to talking a little bit about the difference between an ED going to the trauma center, I can share that I've had a family member who was at a community hospital.
How are they doing now?
They are great.
Excellent.
They had a freaky sports injury occur, and they went to the community hospital. Community hospital saw them, looked at them, and said, you know, your injury is at the point where we can't help you.
Right.
We're going to send you to Cooper.
Yes.
And off to Cooper he came, where he was met with an orthopedic trauma specialist who was able to take care of the injury itself. So I think.
Well, I'm glad he's doing well. The thing that you point out that we haven't mentioned is, so when another hospital calls us and says that they have a patient they want to transfer, the person that gets on the phone is an attending trauma surgeon. It's not a unit secretary. It's not one of the surgical residents. It's one of the trauma attendings. And we have a rule that when an outside hospital calls, if the trauma attending doesn't answer in the first 5 rings, we call the backup surgeon. We always have a backup surgeon on call, and that person would get the call. If that person doesn't answer in 5 rings, then they call me, and then I call the other 2. But we have a system, and then although we listen intently to what the other hospital has to say, we always say yes. They call us and they may think they're convincing us to take the patient, but we always say yes. We're listening to get the details so that we can better take care of the patient when they arrive, but they're not convincing us to take the patient, because our rule is if you call us, we say yes.
Okay, that is good to know. My family member thanks Cooper for the great care that they did receive. I think we're getting close to the end of our time.
Okay.
So is there anything that I missed that you want to
I just want to emphasize the nurses one more time. Not just because it's nursing week, but we have something special at Cooper that most trauma centers don't have. Our trauma center is actually separate from the emergency department. We have our own area, trauma admitting area, and it's staffed by our trauma ICU nurses. So one is there all the time. A patient comes in, another nurse comes down and takes care of that patient. So if you're hurt badly enough to have to go to the ICU, that nurse was there taking care of you in trauma admitting, and then takes care of you in the ICU. So there's no handoff. There's no mistakes because, well, did I tell you what happened here, what happened there? So the same person's taking care of you, so that when the family sees that nurse, and then when they get up to the ICU, they see that nurse. So with family issues, it's the same person. So that truly makes us special. And every time the American College of Surgeons comes to verify us, they say, "Oh my God, that is so cool," and we wish other centers had that. And so it's nice that it's Trauma Awareness Month and it's Nursing Week, so that I get to highlight the specialness of the nursing staff that we have taking care of trauma.
Thank you. Thank you for doing that. Our nurses are awesome here at Cooper, and we love them. If you have any other questions, anyone out there, in regards to trauma centers, the difference between a trauma center and an ED, please feel free to make a comment on the post. We can get your questions answered. If you want to learn more about the programs that Cooper offers, where we can kind of come out to the community, we can do the Stop the Bleed programming, we can do the fall prevention, the TIPS program, safe driving, all that stuff. Please visit our website, cooperhealth.org/trauma, and check out the programs that we offer and reach out to us. We'd love to come out and help prevent trauma so you don't end up here at Cooper. Thank you again for tuning in, and we hope to see you next time.
Thank you very much. Thanks for having me.